I can't believe it's the last week of July already. Normally I'd be dreading the end of summer, but I understand that summer lasts longer here, so I guess that's good news for me. Today I want to put a spotlight on our Masters in Health Informatics. And this is a program that's been around for a couple of years, and we have a lot of graduates who are employed at our health system from there. Jonathan Reeder, who's an emergency physician, is the program director, and the assistant director is Estefani, and it's managed by Quincy.
Hi, I'm Jonathan Reeder, interim program director for the Master of Science in Health Informatics. The goal of our program is to train the next generation of innovators and change makers in the field of healthcare. As you know, healthcare is a fundamentally data-driven endeavor. It relies on our ability to collect and make sense of large amounts of data. And so in our program, we train students in the art and science of data collection, data manipulation, data storage, data analysis, clinical decision support, machine learning and artificial intelligence, application development, all of the tools that you would need to be the driver of innovation in the field of healthcare.
Hello, my name is Estefani. I'm a physician by training with a strong focus on clinical innovation and technology, which is why I pursued a master's in health informatics here at UT Southwestern. And this program gave me the tools to learn how to navigate complex healthcare scenarios and design data-driven efficient systems. But more than anything, it gave me the ability to turn my ideas into real-world solutions.
Hi, my name is Aditi. I currently work as an informatics program manager with Clinical Informatics Center at UT Southwestern Medical Center. I recently graduated with Masters in Health Informatics from UT Southwestern, and I would say it was a transformative journey for me, especially coming from a non-technical background. What stood out to me the most about this program is that we actually had practical experiences where we built real-world health applications and also worked on clinical decision support system workflows. I also got opportunity to work on projects related to machine learning, project management, and all this together helped me to build solid foundation in interdisciplinary fields of informatics.
I met with Dr. Lee this week, and it was wonderful to hear him say that clinical informatics is critical to our success here at UT Southwestern and to the future of healthcare. That's why I came here, because at all different levels, people believe this, and there's evidence that we're implementing it and using it to improve patient outcomes. And I wondered, if clinical informatics is so important, and of course I think it is, then training 15 students a year, which is what we're doing, just isn't good enough. And I'd appreciate your thoughts about who else we should be training. The roles of clinicians are changing with technology and with AI. The role of patients is changing, and there are many more opportunities now for non-clinical people to contribute to the healthcare system. I want to share something that we did at the University of Melbourne that was quite effective in the healthcare system there, and that was a short course. It was a 13-week course, but it wasn't for university credit, so it's professional education on applied learning health systems. And in this course, we created a scenario of a fake clinic, the Mount Superior Diabetes Clinic, where the problem that we were trying to address as a learning health community was that there were too many hospital admissions from our people with diabetes, and we had too many waiting lists to see endocrinologists. And so in that class, they walked through this scenario the entire 13 weeks, identifying predictors from hospitalization from a real data set. So they ran machine learning algorithms using Jupyter notebooks. They designed solutions using design thinking. And they built the back-end communications for an app for patients to monitor their diabetes between the clinic, and set up an evaluation plan and an implementation plan for that. It was a special part of it was that it was very hands-on, and so we created these personas for 3 people with diabetes and 3 clinicians, and we had actors act as if they were people with diabetes so that they could really talk about what it meant to live with diabetes and what their pain points were. And then the real clinicians also talked about the challenges in the healthcare system with trying to care for these people. If you're interested, you can read more about it in a paper that we published, and there are many great papers coming out right now about education in this new era of AI. How do we train people when large language models are going to become a big part of practice? And how do we prepare physicians to interact with and use algorithms? Because these are things that we aren't training people for. Well, this week I'm going to be talking a lot with the Informatics Coordinating Office of the CTSA. And this group is really working with researchers to help apply informatics principles to translate their research to practice. Looking forward to sharing that with you next week. And I'll leave you with Gorm, who is our Husky Malamute mix. He is named after the first king of Denmark, who's in my family tree. And he is a carnivore, but this is his one exception, is he loves carrots. We'll see you next week.